Good morning, everyone. Thanks so much for being here today. I want to commend everyone for showing up and being here. And in some ways, I feel like I'm preaching to the choir here. Because if you're here, you're showing an interest in your health and well-being. And hopefully some of the additional services and information I have for you today will kind of expand your capacity to take care of yourself. So what does the social worker do here at Wills Eye? What we do is I'm trying to identify the gaps. What are the unique patient needs beyond medical? And we really do, when I meet with someone, I really try to look at where they're at in the process. I mean, I look at how old someone is, are they working, are they not working, what kind of daily responsibilities do they have, and what kind of activities and priorities does the patient have. This is really like the most social worky thing, meeting the patient where they're at. So what your priorities are and what you would like to get done and try to get help with is what I am interested in helping you with. And really any social worker if you're seeing someone outside of Wills here. There's a couple different areas for intervention that I tend to look at, and are the resources that I connect people to fall into some different categories. The first one is adapting to low vision. There's a variety of providers out there that can really help people adapt to their vision loss. And because with many vision loss conditions, and glaucoma in particular, it's a gradual process. So you may have to make adaptations, as things go along. We also like to make sure that people are aware of all the programs and services that are available out there to them. Each community provides very similar programs that should be available to people, but they're administrated differently. And so knowing where to go in your community is very important too, and I help people with that. And then, of course, we always want to help people make sure that their home is as safe as possible and their daily living needs are being met. So if there's something in your day-to-day that your vision loss may be interfering with, that's something you can talk to me about, and we can identify what resources are out there to help you kind of bridge that gap, make sure you can keep up with what you want to do. And then last but not least, is financial assistance. Any chronic condition can be an expensive endeavor, and it's always important to reach out and get an idea of what's available out there to help you with the costs, whether it's the costs of your prescriptions or your insurance. As has been mentioned before, there is assistance out there, and I'm happy to walk through some of that with you. So one of the first things I like to do if someone is saying their low vision is creating some obstacles in their day-to-day is we make a lot of referrals to low vision rehab. And that's different than just seeing a regular eye doctor, because that's someone who is going to give you a comprehensive evaluation based on your vision deficiencies and be able to provide specific equipment or corrective lenses that can help with the deficits that you have. A lot of times when I talk to patients about this, I say it's really, these kind of providers help you maximize what you do have. So it's like making the most of the vision you have, teaching you tricks to, get the most out of what's there. In addition, most of these places have interdisciplinary teams. So in addition to a social worker like me, they might have technology experts, they'll have occupational therapists a lot of times, and those folks can be great in helping you, identify the issues you have and coming up with specific strategies to address them. There's a variety of providers in our area. Most of them, all of them except a number of insurances. And getting a referral from your doctor to that is really easy, and we're able to provide your low vision rehab provider with your most recent tests and results, so they'll have the information they need when you go in. Another great service that I think we really underutilize, and you'll hear more about this after me, is low vision occupational therapy. it really is a great way to help you maintain and maximize your independence. It's small tweaks in your day-to-day. It's different ways to understand your environment and make sure your environment is meeting your needs. And Joe Carradine, who's going to be here after me, is going to be able to explain a lot of the specific ways that low vision therapy can help. And again, because this disease is a progressive disease, this may be something you're going to want to check in with over the course of time. So you may have a need now, but then as things change, you can go back and check back in. Another great resource we have here is Temple Tech Owl. We're so lucky. At Temple University, they have the Pennsylvania Initiative on Adaptive Technology, and it's a clearinghouse for all kinds of adaptive technology. They have specialists that you can meet with that will help you identify the technology that might work for you. They have a lending library where you can use this technology at home, see if it works for you in your home before you decide to purchase it. They have a helpline where you can call and ask questions about, is this kind of technology available? It's a great resource and something that's available to all Pennsylvanians, but here in Philadelphia, we're fortunate that they have the office right here at Temple. I just want to point out that all the information about these programs is available out there on the table I have outside. But this one's a gem. They also have, Temple Tech Owl also has a phone if you're having trouble with your outgoing phone. If the vision is so low, they've got special phones for people with low vision. And they're also transitioning into using tablets, helping people use tablets and other technology in their homes as well. So it's a great resource. Another great source of information and support for people are support groups. Now, there's not a ton of them out there, but we are fortunate that there's a couple in our area. And I think when people initially think of a support group, they think of emotional support, and that is a big part of it. However, in my experience, support groups are the best place to get really practical information about how other people are coping with the challenges that you face. There's really no better way to get the information you need than maybe from someone who's been there and done that. And so by participating and connecting with other people who are dealing with the same issues as you, you're really opening yourself up to, getting some great information from, someone who's walking in your shoes. Got information about that as well. You can also come to us, come to me, if you want additional information about your condition, or if you would like additional treatment information. I know they've talked about a lot of different things here. I'm always happy to help people follow up on, something they've heard in the news or something they're interested in. We're happy to help people with that. Another really good organization that's available to folks is the Pennsylvania Council for the Blind. That's a peer-to-peer network that does education, support. They have an annual conference that was just held out in Harrisburg, but that's really a great way to get some additional information. So obviously, since you're here, that's an indication that you're interested in learning more, and these are some different ways for you to learn more. And by participating in some of these things, you might be able to share your knowledge with other people, which is always helpful. There's also Cheryl that I work with is out at the social work table as well. She's our research coordinator. She does a lot to help people who are interested in participating in research studies. I know a lot of patients feel a lot of satisfaction by being able to contribute their experience or any knowledge people can gain from their condition. So if you're interested in participating in research, Cheryl's out there to talk to. Some of the community-based resources that we refer to a lot are the community-based programs for the blind and visually impaired. Now that's a statewide funded program, but it's done individually on a county-by-county basis. So here in Philadelphia, it's the Associated Services for the Blind and Visually Impaired. They're right across the street at 919 Walnut. They provide a variety of services. Some of them are more practical, like mobility training. Some of them are more social, like guided museum tours. But they're a great way to tap into additional supports. Every county has one. They're all run a little bit differently, but that's something we're always happy to make a referral to. The area agencies on aging, those are services, that's an entity that helps people specifically who have questions about what resources are available to me because I'm an older adult. Again, those are run a little differently county to county, but that's a great starting place. If you're interested in Meals on Wheels or assistance with transportation, things like that, we can link you up with that. The Library of Congress has the National Library Service for the Blind. Here in Philadelphia, we've got a specific library through the Free Library that does the talking books for people who are blind and with visual impairments. It's a great program. It's free. They pay for the postage to have periodicals and books delivered to your home that you can listen to. In addition, they have a downloadable service that you can use on your phone so you don't have to deal with the mail. If you're more interested in using your current technology, you can do that as well, but it's a great service. And it's available to anyone, so if you just are looking for a way to kind of enhance what kind of entertainment you can consume because your eyes are weary from reading or it's just getting to be too much, it's a great thing to add on early. You don't have to wait for that. And every community also has a family caregiver support program. So if you're here because you're taking care of a loved one that has a vision loss, you can look into the services they support, but those are services that are specifically for caregivers that can help you take care, of your family members. All right. So when we talk about home and daily living needs, one of the most frequent questions I get from people is, how do I get an aid into my house? I want to get some help in the home. Well, there's a program through the state called the Home and Community-Based Waiver Program, and that's administered locally through the counties. The program has criteria based on your level of functioning and your income as well, and I can talk to people through the process of that and give people an idea of whether or not they might be eligible for services funded through the state program. For people who aren't eligible for that, we also have, the way that we can identify providers in your community that are comfortable working with people with low vision and get you some services in the home. All right. Something else we really try to connect people with are safety and mobility repairs and modifications. So for people who are living in their home and obviously wanting to remain independent, there's a variety of programs out there that can help people make home modifications and repairs to their homes to keep it as accessible as possible. Again, depending on where you live, will kind of dictate what programs are available. But I'm happy to sit down with people and work with them to see, if there's any home-based needs, what programs might be able to support them. All right, now the big one is transportation and parking. That becomes a big issue for people as they kind of move in one direction away from driving, or if they even find taking SEPTA more difficult than it used to be. So SEPTA has a couple, for people who ride public transportation, SEPTA has a couple different transportation programs. We can help you with the application. We can get the clinical information that they need. We also help people get parking placards. If you're a passenger and you have a vision impairment and it's becoming too much for you to walk all the way through the parking lots or get to where you need, that's a very easy thing for us to help you get just to make your day-to-day easier. All right. Now, financial assistance, that's a big one. A lot of what I do is I work with people to help them understand their insurance and to determine what, if anything, can be done to bring their costs down. For those of you who have Medicare, probably the most important thing to remember right now is that we're in the Medicare annual enrollment period. And if you are experiencing high costs for your prescriptions, co-pays that you're finding unmanageable, now is the time to do a plan comparison and make sure that your choices for 2020 are going to be, the best choices available to you. Your prescription drug companies, your Medicare Advantage plan, they can change their formularies from year to year. So it's really important to check that the prices of your eye drops, what you're paying this year, are going to be the same for next year. And that's something I'm happy to help you with. There's agencies out there that provide this service as well, but there are, it's very important that you check to make sure that, your needs for the coming year are going to be met. In addition, I can help people apply for prescription assistance programs through their various states. Every state has something called the prescription assistance programs. In PA, it's called PACE, and that's a way to help bring costs down. For people who are still working, I can help with your paperwork. We're always happy to make sure that if you need to, maintain your income while you're out after surgery and things like that, that we can get all your paperwork done. And for those people who are still employed, those patients that are still employed, we do, make referrals to the Office of Vocational Rehab, and that really provides people with the supports they need to stay in the workplace. They really provide a lot of services. There's counseling, there's training, there's placement assistance, assistive technology, and support services. But that is one of those entities that is a little bit harder to work with than most. So it requires a level of patience that I'm happy to kind of guide people through. And there's other providers out there that can help people manage, getting back into the workplace. And of course, we're always available to, address your other needs and concerns. A lot of times people will come to me with a question and my answer is, well, I don't know the answer to that, but I can find out. And so if you identify a need that you have and that you can't figure out where to go to get assistance, you can come to me and I'm happy to work with you and make sure that we're getting you the services you need, to maintain your independence and maximize your life. All right. Are there any questions? All right. Any questions about your Medicare coverage for next year? Okay.